Good morning. Welcome to the webcast titled Breastfeeding Clinical Skills. I'm one of your hosts, Heidi Mackey. In my background, I have a degree in nutrition, and that started with 15 years in a hospital setting, and 7 of those being on an OB unit. I was part of the team that achieved Michigan's first baby-friendly hospital and the 4th in the United States. I had 5 years after that as a WIC CPA, one of my favorite roles, and a breastfeeding coordinator. And I hope to share some ideas today about making breastfeeding support work as a busy CPA. I currently am an International Board Certified Lactation Consultant contractor with the State of Michigan WIC program, and my designated area of the state is in the Mid-Central region. Alice can introduce herself now.
Good morning. My name is Alice Christensen. I'm a nurse and an International Board Certified Lactation Consultant. I have over 35 years of experience as a maternal child nurse and a lactation consultant as an in-home visitor and at a hospital maternal child department. I currently am a consultant with the MDHHS WIC and work on different breastfeeding programs throughout the state. Welcome to this morning's Breastfeeding Clinical Skills webcast.
This webcast, again, Breastfeeding Clinical Skills, is a shorter version of a course taught to CPAs around the state in the spring and summer of 2016. And it's meant to promote greater confidence in assessment and feeding plan skills for your clients with breastfeeding issues. It's targeted towards all CPAs, and it will be archived and is recommended as part of breastfeeding training for CPAs after they've attended breastfeeding basics. Today's agenda, in today's agenda, you have some handouts available to you that you may want to use to follow along with us. Those are the history taking and assessment tool from May 2016, the breastfeeding assessment from 2017, and the feeding plan. So those are the 3 handouts we'll be using today that you may want to take notes on. During our time, we will be viewing a real mom and baby visit, and we will be discussing and assessing breastfeeding and developing a feeding plan based on findings from our assessment. Be prepared to send any questions you may have for our time of Q&A at the end. So here we go. We're going to start talking about a feeding plan. The end result of every infant feeding situation is to come up with a feeding plan. We are promoting the use of a 3-step approach. CPAs that we've taught this approach to say that it helps them focus on what's really important. It's provided them with a sense of calm and confidence, and it gives them a logical approach to every breastfeeding situation. So please try to memorize these steps. Feed your baby, protect your milk supply, and seek a solution. In the history taking and assessment, that's what we're going to start out with. And you may want to look at or take notes again on that tool that we gave you. As a WIC CPA, you already know so much of the information that can be gathered from my WIC, and don't forget to use your peer, as she may have gotten to know this mom prenatally even and has a lot of that information for you. So note with history taking that you already know using mom and baby names frequently conveys a sense that you know and you care about your clients. So use their names as much as you can. Age also is imperative to understanding breastfeeding issues. Your expectations of a 5-day-old obviously are quite different than that of a 5-week-old. So that applies to moms too, though. Remember, there's a vast difference between a first-time 15-year-old mom and a 40-year-old mom of 4. Start your conversation like you always do, using client-centered care. Ask mom open-ended questions and really get to know what her sense is of what is wrong or what is concerning her. See yourself as her partner. She likely has answers to her own concerns, and remember, she knows her baby better than we do. You may, if you have time, get some good information from finding out about her birth story. Her method of birth could be important, whether, she had a C-section or a vaginal birth. What was the gestational age of the baby? Was it full term, premature, or late preterm? You've already gathered a lot of this on MyWix, so you can just fill those in very quickly. The number of pregnancies and live births, obviously, you know that as well. When you're finding out birth weight of the baby, try to find out what was the birth weight. If they know the birth weight, the weight at 1 day of age, that's helpful, and the discharge weight, and what was the last weight of the baby. Those can all be helpful in determining proper weight gain if that's an issue. And we'll be discussing some of these more fully later in the webcast. Gather a pre-feeding weight and a post-feeding weight to estimate how much the baby took in during the feeding that you will watch. WIC does an excellent job of gathering anthropometrics already, so make sure you use the tech who is well trained in that to get your good weights. We'll start out talking a little bit about history taking. Use your open-ended questions and in gathering feeding information. Say things like, tell me about your baby's feedings. Tell me about your baby's last feeding. When was that? How was the baby fed at that feeding? How much did the baby take in ounces if they know? How long did it take? Those seem like they are so obvious, but I'm telling you, they are so important. We always like to tease one of our lactation consultants who tells us a story that she was doing a consult with a baby who wouldn't latch and was very sleepy, and she worked for over an hour with this mom and baby before finding out that the baby had been given 3 ounces of formula 15 minutes before the consult. So it's hard to say how sleepy that baby was. It just wasn't hungry. Find out about output. Are those wet diapers really wet, or are they just damp? And what is the color, consistency, and amount of dirty diapers? Find out about the mom's opinion of baby behaviors. Does the baby wake itself to feed? Is it what she calls a sleepy baby? Are the feedings short or long, and what does she think is short or long? Is the baby fussy? Is the baby described as a good baby? That term good baby is very concerning if the baby is a few days or even weeks old and sleeps all the time, because this is really not normal behavior. First, we're going to start out with looking at an assessment of the mother, and it may be helpful to think of this in terms of looking from the top of her head to the tips of her toes. Overall, how does she look to you? How is her health? What is her breastfeeding history? Again, checking her birth story if you have time. Did she have an induced labor? Was it a long labor after that? Did she have lots of IV fluids? Did she end up with an epidural and then a cesarean birth? All those things have so much impact on mom's health and how they're feeling, and also on baby's weight. No good assessment of a mom can be without a breast assessment, but remember, you can do this along with the feeding. Breast changes during the pregnancy are important to determine, and explain to mom why you're doing that. You want to know if she has appropriate glandular tissue. Has she ever had any injuries or surgeries to her breasts? And how does this impact lactation? Tell her why you're asking these things. As you're doing this, it's a great way to make her feel like she's normal as well. Now, we don't need to explain why all these things are going on, because those are things we should have learned in breastfeeding basics, but it's helpful to tell moms why we're asking them. Ask mom if she takes any medications, vitamins, herbs, or supplements, and any birth control that she's planning to use or has been using. How about postpartum vaginal bleeding? It's important to find out about that as well to make sure that she didn't have any retained placenta. What is it currently, and what did she have the first few weeks postpartum? Has her period started again? When you're assessing a baby, think of that also as a head-to-toe assessment as you're working your way down. Overall, how does that baby look? What is the skin color, the tone, and any health issues the baby may have? Look in terms of symmetry at a baby, and watch as Alice does this in our video, how well she does checking if the baby has a nice round head, if it's symmetrical, if she can notice the soft spots. As she checks the mouth and lips, she's looking for blisters and whether the baby sucks those lips in. She's watching for rooting and sucking, and make sure you're checking how Alice does that in the video. Then she works her way down to the upper body. Are the movements equal on both sides of the baby? Is the skin and fat hydrated, or is it hanging and loose? Same with the arms and legs. Are those movements equal? How about the skin there? When she does an oral assessment, she's looking at the tongue, the roof of the mouth, and she's assessing sucking. So we'll be able to see all of that in the video. Within the WIC setting as a CPA, make sure that you check with your peer on any of things that she has noticed when seeing this mom. They oftentimes have written down great notes for themselves about what they've observed or what moms anticipated even before they delivered. And as CPAs, work together until everyone is comfortable. Develop partnerships with one another where you fill in for one another when a particular appointment will probably take longer. Breastfeeding appointments just do tend to take a little bit longer, but if everyone knows that someone will fill in for them if they take a bit longer with what's important, that's a way of promoting the culture that breastfeeding comes first in your clinic. So when we watch this first part of the breastfeeding assessment that Alice does, I want you to watch for these things: positioning, latch, active eating, whether you notice the mom being in pain, the length of the feeding, and the baby behavior. Watch for all of those. And before we get started on watching that video, I just wanted to make sure that we say thank you to Stephanie, who is our mom, and Francis, who is our sweet baby, and Stacy, who is the peer counselor at Ingham County, who helped to bring them to us, and MPHI for doing our videotaping and helping us put all this together for us. I want you to know that this is a real mom and baby. This was not staged, and the lactation consultant and mom had never met before. So the whole assessment you're going to see is real. We're going to be dividing this up into 4 sections. First, we will watch history taking for about 5 minutes, and then we'll stop and discuss it. Next, we will watch an assessment of the mom, then stop and discuss it. Then an assessment of the baby, stop and discuss it. And finally, we'll watch the summary and feeding plan discussion with the mom. So first, get ready for history taking.
Hi Stephanie, my name is Alice, and I work with breastfeeding here at WIC. Thanks for coming in. What's your baby's name?
Francis.
How old is Francis?
6 weeks.
What was his actual date of birth?
1/13/17.
So, I understand you're having some concerns with breastfeeding. What are those?
My biggest concern is it's painful to latch them on.
And how long has that been for?
Probably like 3 or 4 weeks.
I want to take a little bit more time today and focus in on and look at breastfeeding and see if we can help you some. Do you have time today
Yeah.
for me to do a little more in-depth assessment? Okay. And then what I need you to help me with, if at any point Francis says, I want to eat, you let me know and we will stop. Because part of the visit today, Francis, is to actually watch you breastfeed. Yeah. In addition to just talking about it. Is that okay? So alert. Nice job.
Yeah.
So, is this number 1 baby for you?
Number 2.
2? How did breastfeeding go with your first?
About the same.
Okay. So the same in terms of pain.
Yeah, at this age.
Okay, at this age. Was he a healthy full-term baby?
Yes.
And your pregnancy was pretty normal?
Yeah, gestational diabetes.
Okay. All right. Did you have that with your first?
No.
Too? Okay. And how was the gestational diabetes managed for you?
Good.
Yeah. Just diet, or did you
Yeah,
have medicine?
just diet.
Okay. All right. What was his birth weight? Yeah.
8 pounds, 15 ounces.
How did that compare to your first baby?
Exactly 1 pound heavier.
Okay. All right. And how has his weight gain been?
Good.
Okay. As I see today, he's 12 pounds, 3 ounces, which is good for his age. But what we'll also do today is after a feeding, we're going to re-weigh him to see how much he took in. All right? How many wet diapers does he have a day and poopy diapers?
Wet diapers probably like 8.
Okay.
Poopy diapers, maybe 1 or 2, maybe sometimes every other day.
Okay. All right. And what's the consistency of those?
Liquid.
Okay. All right. And what color?
Yellow.
That reminds you of your first baby's
Yeah.
poops? Okay. All right. So tell me a little bit more about the feedings, like how often, how you feed him.
Just on demand every couple hours, or maybe every 3 hours or 4 hours if he's sleeping.
Okay. And you put him to the breast all the time?
No,
What?
sometimes I pump because of the pain and bottle feed, and sometimes I put him on the breast.
Okay. Does it hurt to pump?
No.
All right, so it only hurts to breastfeed. And does it hurt the entire feeding with breastfeeding?
It depends on how sore I am. If I'm not that sore, then it just hurts the latch.
Okay. Okay. And when he takes a bottle, how much does he take?
3 ounces.
3 ounces.
Maybe
When-
3.5 sometimes.
Yeah. When did he last eat today?
8:30.
Okay. And what method of feeding was that?
Breast.
Breast. Okay. And for how many minutes about?
About 5 minutes on each side.
And is that typical?
Yeah.
Okay. And do you remember that being the same way with your first?
Yeah, I have a fast flow.
Yeah, because that's a pretty short period of time.
Yeah.
Okay, all right. So, the birth, uncomplicated vaginal birth or a cesarean?
C-section.
Was that a repeat C-section? Okay. And how long did you breastfeed your first baby?
11 months.
Okay. And how long did that pain stay with you?
Probably the first 2 to 3 months.
What made it change?
I did start taking Primrose oil,
Okay.
so I think that might have helped.
Okay. All right. All right. Are you taking some of that now?
Yes.
And how much and how often?
Just once a day.
Is it a dropper full? Is it a capsule?
It's a capsule.
Capsule.
Yeah, that's what they told me at the breastfeeding clinic.
Yeah.
All right, so now let's talk about that first part of the assessment, the history taking. So for the purposes of age of Francis, at the time of this recording, Francis was 6 weeks old and 4 days. In terms of mom's pain, mom told us that her nipple pain started around 2 weeks postpartum. So thus, she has had this pain for about 4 weeks now. The gestational diabetes discussion. I just wanted to point out that I used the word manage in terms of how did she manage her gestational diabetes. And I could kind of sense during the assessment that she maybe didn't quite understand what I was saying or what I was asking. But we did then clarify. But gestational diabetes is important for us to consider due to the fact that it may be related to an underlying metabolic issue, and some metabolic issues can contribute to milk production concerns. So we're just going to kind of keep that in the back of our mind as we piece together the rest of Stephanie's story and issues with feeding Frances. Reinforcing normal. When mom told me how many wet diapers and dirty diapers Frances was having, I did not tell her that that was normal and good. We really, as healthcare providers, we tend to ask a lot of questions, and this can create in clients a sense of what are they looking for? What is normal? Thus, it's important to share with mom when she shares something normal to tell her that it is normal. So the last feeding, she stated, was around 8:30, but again, for purposes of this assessment, that was about 2.5 to 3 hours before this actual breastfeeding assessment was taped. So Frances should be wanting to eat shortly, so we're going to keep a watch on that. We have a little typo here. It's not prime rose, but it was primrose oil that Stephanie indicated she was taking. It is true that some moms take this for vasospasms, but as a lactation consultant, it is not in my scope of practice to prescribe meds, vitamins, supplements, or herbs. Yet when they tell me they are taking a medication, or herb, or supplement, it is my responsibility to refer them to their doctor for advice on the safety of taking it while breastfeeding. Now, we can educate moms about the safety of the various meds or herbs or supplements. We can make copies of these items from the book Medication in Mother's Milk for mom to take and discuss with her doctor. The other part of this story is Frances's weight, and I wanted to dig a little bit deeper around that. So we know that Frances's birth weight was 8 pounds 15 ounces. And we know that today's weight, on the day of the assessment, Frances weighed 12 pounds 3 ounces. So I converted the 8 pounds 15 ounces of birth weight to total ounces, and the 12 pounds 3 ounces of today's weight to total ounces. And then I subtracted the two. So 12 pounds 3 ounces is really 195 ounces, and I took 143 ounces from that, which was what the 8 pounds 15 ounces converts to, and came up with that Frances had gained a total of 52 ounces since birth. Now, I don't know if birth weight was lowest weight, but that's the only fact I knew from this assessment. Then I took the 52 total ounces and divided by the number of weeks old that Frances is. So 52 divided by 6 equals 8.6 ounces per week. That is great. That's a great weight gain. If normal is a ½ ounce to an ounce a day, or 4 to 7 ounces per week, Frances is doing that. He's gaining like he should. And infant weight gain was not one of Stephanie's concerns. But if weight gain is a concern, either for mom or for you, the CPA, that could be a higher level skill, and you may need to collaborate and or refer baby and mom to your designated breastfeeding expert. All right, we are going to now continue with the assessment, and we're going to dig a little bit deeper into mom's assessment of mom.
ask you is just to help me make sure your body is all working in, it appears in terms of growth, your baby's doing great and you're making enough milk, but just to kind of help point out normal. When you were pregnant with Francis, did you have any breast changes at all?
No.
No? They didn't increase in size? They didn't become
Yeah, I
tender?
think they weren't tender, but
Okay.
I think they didn't increase.
Were you still breastfeeding your first baby?
I dried up pretty quickly.
Okay, once you became pregnant.
Yeah.
Yeah, all right. And then after Francis was born, when do you remember your milk volume increasing?
When my milk came in? 3 days.
Okay. Which again reminds you of
Yeah.
your first
Well, I
baby?
can't feed them until my milk comes in on the breast.
Oh, okay. Tell me more about that.
I have flat nipples,
Okay.
so I use a nipple shield.
Okay.
But sometimes he can latch without it now because my nipples have drawn out
Okay.
enough.
All right. So in the hospital, he didn't go to the breast those first few
We
days?
tried.
Okay.
The lactation consultant got him latched once, but that was the only time he latched.
Did you start pumping
Yeah.
right away in the hospital?
Yep, pump and hand express and syringe feeding,
Good job.
everything.
How was your production?
At first I had enough, but then I kind of stopped producing, so he did go on formula
Okay.
for about a day.
All right. Very good. And did you have your own personal pump that you were using in addition
I
to
used
your
the
hand, or
hospital.
you used the hospital one?
Yeah.
Okay. Very good. So it sounds like you knew to stimulate those breasts a lot in the first 3 days because,
Yeah.
as we know,
And we attempted every time
good.
to latch.
Good. Someone taught you well that you need to try at the breast, but if not, then stimulate so you have a good milk production. Again, you let me know when you think he's ready.
Probably
To
any
eat.
time. Doesn't really matter.
Any other medications you're on?
Just birth control, and I'm taking turmeric capsule.
All right. What type of birth control?
The mini pill, the one that's just estrogen.
And when did you start that?
3 days ago.
3 days ago?
Yeah.
Or 30?
3.
Okay. So, nice that you waited till you were in more full milk production to start that birth control. Did you use the mini pill with your first baby?
Yeah.
Okay. All right. And you didn't see it impact your milk supply at all?
No.
Prior to getting pregnant, was your menstrual cycle pretty normal?
Mhm.
And since you've had him, did you do a lot of heavy bleeding the first day or two, and then it slowed down
Yeah.
and maybe was pinkish, brownish for a number of weeks?
Yeah.
Or did it stop completely?
Yeah.
Okay, all right. And never passed any clots after being discharged from the hospital?
Just small ones.
Okay, all right. But again, your bleeding did completely stop?
Yeah.
All right. And you haven't had your period return?
No.
Okay, so let's discuss the assessment of mom that we just watched a little bit. One thing I want to point out is that we always want to praise moms as much as possible. Building their self-esteem, their self-efficacy with breastfeeding is probably 90% of what a lactation consultant does. However, sometimes moms say things that are not exactly as a clinician how we would have said them or how we would have understood them. It's not always important to correct them on those things. So as I go through this, I just want to mention that there are some of those things there, and we did notice them, but we don't necessarily see a reason to tell Stephanie that we would call it something differently. She did indicate that she had had enough milk for her first baby, and that her milk came in 3 days. Now, note that when we said increase in production, she didn't quite understand that, so she used the phrase milk came in. Also, she said she used a nipple shield because her nipples are flat. But of course, we know that not all people with flat nipples need to use a nipple shield. She was wonderful about knowing that she needed to hand express, or what she did was pump, because she was not effective at getting Francis to the breast in those first 24 hours. And she also mentioned that she did start birth control, For her, this was not an issue at all. It wasn't with her first baby either. She also called that mini pill an estrogen only, but the mini pill is actually progestin. So that's, you know, her production was not impacted by that either time. She also mentioned that she took turmeric. And again, that's something that we should, you know, mention to her, that she should make sure her physician is aware of. But unless she was doing something we knew to be dangerous for her baby or for herself, like chemotherapy, there wouldn't be any reason for us to say anything against that. She also mentioned that she had pretty normal vaginal discharge. So we don't need to worry about retained placenta. So next we're going to see part of the video that talks about assessment of the baby.
So I want to take a look at him a little bit before we put him to the breast and just kind of do a little assessment and to show the audience what all we're looking for. So first thing I see, really good trunk control and good head control, and he's moving all of his arms and his legs. Yes, and he has really good eye contact. I've seen him stick out his tongue and kind of lick his lips a bit. So if you don't mind, may I hold him a second and show a few more things? Yeah. I'm also looking at his head. Oh, I know you don't like to lay down flat. No. Nice and round head. That's really nice. You know, babies have a soft spot there that stays there for about a year. Yeah. Oh, you want to sit up? You want to sit up? You want to look at your mama? Yeah, good. Oh, there's your mama. Talk to him, tell him he's okay. Yeah. You know, babies are born with a rooting reflex. Yeah. Hello. You want to talk to me? Yeah. A lot of times newborns, when we touch there, look your way. But if you can see inside, he's moving his tongue that way to go, what's on the outside of my mouth? Yeah, my cheek. I'm looking to see if he'll stick that tongue out a little bit further. Can you see how when he's trying to stick it out, you see how it's kind of indented in at the tip? So what we prefer to see is a nice round tongue. So which makes me wonder if his little piece of skin, well, now that was beautiful. Yeah, you
I
stuck that
noticed
right
that
out.
he doesn't really open his mouth as wide as I would like. I think that's part of the problem.
Yeah, I agree with you. Yet he's capable, you know, just even touching his chin, he drops it, and sometimes when he got mad, he'd stick that tongue out at me. Does he like tummy time?
Yeah, for a little bit.
I'm looking to see, does he move from side to side, and he is, and I'm going to lift him up. Nice head control, really good. You are so normal. Yeah. So now I'm going to, I have a glove, and I'm going to assess inside his mouth just a little bit more. You want to sit up and look at Mama? Sometimes babies like this better when mamas do it, but we're going to see if he'll tolerate me doing it. Yeah. So this is, again, trying to stimulate the rooting reflex to get him to lick, and open wide. And opens, but he really doesn't lick too much, and that tongue is trying to come out, but it's not. The tongue does follow my finger. I'm gently massaging the inside of his mouth, but it's kind of restricted. It's not, doesn't come over very far always. But when I'm doing a sweep underneath his tongue, I'm looking for a fence or a tight frenulum, and there really isn't. A little one, but not much. Yeah, not much, even though your tip is kind of heart-shaped. Now I'm going to go to the roof of your mouth. Yeah. So the roof of his mouth is really normal. It's nice dome shape. You know, it's not too high, it's not too narrow. But I'm going to see, does he like my finger to be back far? Now, a lot of babies do not like the smell of a gloved finger. and they start biting me or trying to push me out, he's not biting. He's not trying to push me out, but he has no desire to suck. Like, where are you going, lady? Now he's thinking about biting me. He's kind of chomping a little bit. What are you doing? Oh, I know. That went back too far, didn't it? Yeah. So you're exactly right. He doesn't open up wide. That prevents your nipple from getting back far.
Mm-hmm.
Do you have a finger where the nail is trimmed short?
Yeah.
Because I'd like you to try this and see what he does with your finger.
There you're sucking.
So pull out again, and let's tickle between his nose and his chin, and let's get him to tip back a little bit. Move those fingers down more on his shoulder blade and get that chin up in the air. Good, yeah. I'm not quite certain what to do. You go in either.
Take them. Kind of pushes it out.
Uh-huh.
Kind of does that with my nipple too.
That's him trying to prevent things from going back far in his mouth. So the lips relax, the tongue tongue is coming out a bit when he sucks. He's like, there's no milk on this, Mama.
All right, so now let's talk a little bit about the assessment of baby. In this part of the assessment, you observed me do a much better job of reinforcing what was normal with mom and in respect to the baby's assessment. The tongue concerns. So you observed me discuss and point out to mom what I was seeing with respect to the baby's tongue. This is just one part of the evaluation. Before we can say that this tongue is an issue, we really need to watch baby at the breast. Mom states that during this assessment that baby doesn't open his mouth wide. Moms have a sense of what is wrong. We need to listen and respect their mothering instinct. As we put the rest of the assessment together, we need to remember what Stephanie shared with us, and that her sense that her baby is not opening his mouth wide enough for latch. It's a piece of the puzzle. In terms of the oral assessment, if you are not yet comfortable with this type of assessment, please include your designated breastfeeding expert at your local agency in this part of an assessment. Not all babies need an oral assessment, but because she was complaining of nipple pain, pain with the feedings, it is a crucial part of this story and an important part to assess. All right, now we're going to move on and actually watch Frances at the breast. And I want you to pay attention to her mom's position, where she's first going to put baby to the left side, and listen to her pain, her complaint of pain, with and without the nipple shield. And then Frances is going to feed on the right side, and watch how mom positions Frances there. It's all very interesting. It adds a huge piece of the puzzle to this story of nipple pain.
Scale 1 to 10, what's your nipple pain right now?
6.
Not much better. But we're not getting that sloshy, clicky noise, so he's, I would think, on a little deeper.
And this side is more painful than my right side.
I hear swallowing. And again, a nice rocker, and then there's the pause with some breathing. I usually like to look at the clock when babies latch on to see how many minutes they've been breastfeeding for. So he slows down. Is this pretty normal? Mm-hmm. 2 or 3 sucks, pause. 2 or 3 sucks, pause.
Yeah.
Normally a baby would do like 10 to 30 sucks, pause. 10 to 30 sucks, pause. Till the milk is flowing, then slow down like this.
So
Is it because of the flow so
right,
fast?
right. Now,
Lost it.
sloppy. So let's take them off and let's try to latch them without the nipple shield now. Very white nipple, very blanched. Again, and come down and hold that breast more like it's a sandwich. There you go, just like that. Tickle, tickle, good. Scale of 1 to 10. What's your nipple pain like now?
6, 7.
So similar. With the nipple
Yeah.
shield.
It's more
Push
painful without it.
Push his butt in so that his head tips back just a little bit. He's got the same rocker suck, the same 2 to 3 sucks pause.
Sometimes I keep them going to hurry it up. So this is
Yeah, because of the pain.
Yeah.
And what's your pain now?
About the same, about 6. It's kind of sore.
Was it less with the nipple shield or the
Yeah,
same? Less pain?
A little bit less.
See what shape your nipple is when it either stops eating this time or comes off. And you're slowing down. Yeah, come on, Francis. Again, you can hear those swallows, that noise, and the little puff of air out his nose. He's not too agitated. You know, his hands are doing some movement. A little more agitated. And so the 5 minutes is because of your pain? You stop at 5 minutes and he stops at 5 minutes?
Yeah, it's just because I have a fast flow.
Anything you've done over the last couple of weeks to alter that fast flow or that pain?
No.
No.
Just try to get him to open his mouth.
And some of it's not only opening mouth, but also getting that nipple back far. Even with your finger, he did not like things back far.
Yeah, and they said that I have a vasospasm too. That's what is the white.
The white.
Yeah.
Yeah, when the tip of your nipple, when it comes out of his mouth and it's white, he's cut off the circulation. And, yeah, that's why that pain is why it's so painful. What do you do after you're done breastfeeding to kind of mitigate, to
I usually don't do anything. If they're real sore, sometimes I leave my bra open, but that's about it.
so no nipple creams or ointments?
Oh yeah, I do have the cream for the crack. Put that on a couple times a day.
Is this one cracked? The left side's cracked?
No, they're not cracked.
Okay.
They're just to prevent it. Yeah.
Some moms need to fold their arms and keep their breasts warm right after feeding to allow circulation to come back into that nipple. Do you find yourself doing that?
No, I've never tried that.
Your back doesn't get sore in the end?
Yeah. So sometimes I lean back.
Good.
Yeah, that's more comfortable.
Good. Nice. This chair actually reclines a little bit. You're welcome to recline. You know how these...
Okay.
So what's your nipple pain like now? 6, 7,
Maybe
flat?
3.
3. And I see his eyes starting to close. Is that what he does when he tells you he's done with things?
Yeah, it just kind of stops and then kind of fall off. Or if I feel like he's not swallowing, he's doing more sucking than swallowing, I'll pull him off.
And again, at this point, you're able to pump enough milk for him or breastfeed, and you're not using any formula for supplementing. Your milk supply is good,
you're just using the pumping as a break from having him at the
Yeah.
breast. Right. Does pumping help in any other way sometimes?
No.
Sometimes some moms will hand express into a towel or pump a little bit before they latch baby on. If their milk supply is real fast and furious. Have you ever done that?
No, I've never tried that.
He does love breastfeeding.
He's pushing back.
What does that mean to you when you say he's pushing back?
I don't know. Does that sometimes he does that right away?
Yeah.
Sometimes I think it's the flow. I'm not sure.
Yeah, they do it for one of two reasons. One, if the flow's too fast, they just wanted to go there for comfort. Or another reason, okay, I'd like some more milk. Where is the flow? Why isn't the milk coming out? Right, right. And he's used to not having to do much work. And so right now he's like, I think I'm still hungry, but that milk isn't flowing like it was. Yeah, very round, but just white. Very pinched. Very pinched. And that looks pretty normal.
Yeah.
With your first, did that eventually go away at 2 to 3 months? You didn't have that whiteness? Or
I don't remember.
the pain went away?
Yeah, the pain went away.
So now on the right side, do you usually use a nipple shield or no?
Sometimes. I kind of want to start weaning them off of it.
Okay. Yeah. So, maybe massage and maybe pull that nipple out just a little bit so it's a little more to grasp on. Yeah. So you're really not done eating. Yeah. Nice. How you're holding him. Nice. Very nice latch. Cross cradle. Good neck and shoulder hold. He's got space to breathe. Nice. And listen to him. Just swallow. Swallow.
Mm-hmm.
Again, most babies don't get this quick milk supply like this. But he's going 10 or more sucks. Nice. And what's your nipple pain? Scale of 1 to 10.
5.
So again, like you said, not as bad as the other side. What did you think about doing that without the nipple shield?
Good.
Oh,
Yeah.
God, you did great. Are you right-handed or left-handed?
Right-handed.
Okay. A lot of moms who are right-handed feel they do a better job putting babies on the left side, but you feel you get a better latch on the right side.
Yeah.
Is your milk supply pretty equal from one side to the other?
Yeah, I think so. When I pump, I get a little less on the side.
Okay.
But I was putting them on the left side first for a while, just to get the painful one done with. And now I'm trying to do both sides.
So now you hear him.
First.
He's getting really overwhelmed.
Mm-hmm.
That lots of gulping. He didn't arch away. Some babies, their eyes get real watery if they're overwhelmed at the breast. What's your pain now? Nipple pain like now?
Maybe a 1 or 2.
Yeah, 'cause he's really relaxing and getting into active eating. Again, nice rocker, jaw action, and lots of space between chin and the chest to go up, straight into the breast there. You're meticulous technique. Nice job. I don't so much see this as something you need to fix. It's more he needs to fix to like things in deeper.
Yeah.
No pause there. It's really about the first significant pause he's had. It's been about 2 minutes. And so now we're back into that 2 to 3 sucks. 2 to 3 sucks. And doing 2 to 3 sucks isn't going to create another letdown, another release of milk. So we'll see if he gets agitated, gets happy, and pulls himself off because he's content, had enough to eat. hungry. Now he's back into act. What's your nipple pain like now?
It's like a 1.
While he's eating, I'm going to just take a look here. What other things we can talk about? Like I said, your positioning is good. He's a fast eater. And he actively eats for about 2 minutes, and then he really slows down. And does it hurt to pump?
No.
No pain with pumping.
I mean, as long as I don't pump up too high.
Well, good. Would be normal. And you don't get the white color either?
I think I do.
Okay. Sometimes if it is like true vasospasms, pumping will also hurt. Which again leads me to go back to your mothering instinct. He's not opening up wide enough, and he's not staying latched on deeply. Now, how does that feel? He's changed positions just a little bit.
Good.
Does it? Okay. All right. I see a lot more movement of your breast tissue in his mouth. Sometimes that indicates baby has slipped off a little bit, but your pain hasn't gone up. I'm not going to worry about it. Let pain be your guide. He is much calmer on this side than the other side.
Yeah.
He has slipped off a little bit, but your pain hasn't gone up. I'm not going to worry about it. Let pain be your guide. He is much calmer on this side than the other side.
Yeah.
And some of that could be if you've got more pain on the left side, the milk isn't flowing the same rate. Or it could be the milk is flowing way faster on that side than this side, so he needs to pinch or control the flow. It's very peaceful here. Notice this hand is starting to open up. Babies' hands are their gas gauge. When they're hungry, they're tight and fisted. As he's getting milk, those hands open up and they relax. Falling asleep at the breast isn't always a sign that they've had enough to eat. It can just mean they fell asleep.
Yeah, especially when they're real little.
Right. And like he fell asleep over there, you took him off, got him ready to go over to the right side, and he got all agitated and crying. Like, I wasn't done eating, Mom. And now he's getting a little more agitated, closer to the 5 to 6 minute mark of feeding.
Yeah, I think he's about done.
And then how long does a feeding like this usually sustain him? Again, looking at your nipple, it's a bit blanched, a little flat on the back side there, but I've seen worse.
He usually goes to the normal amount, about 2 to 3 hours, depends.
With 5 to 10 minutes aside.
Yeah. About the same amount he does with the bottle.
Okay.
Now I'd like to talk a little bit about what I noticed during the assessment of that feeding. Every time I watch this assessment, I notice something else. It's great to watch an experienced lactation consultant work with someone, so when you have the chance, do that. But notice how Alice is knee to knee and eye to eye with Stephanie and is very, very affirming. She helps to build confidence in Stephanie as, her ability as a mother. Who wouldn't want that kind of discussion with their healthcare clinician? One thing that I noticed was that even though Stephanie said that her pain was less with a shield, she didn't say that she didn't rate it as significantly different with and without the shield. What seemed to actually decrease her pain was when she relaxed and brought the baby to her rather than her to the baby. So when she was in more of a laid back position and drew Julian in, she rated her pain as actually going down. We did see good jaw rocker motion and frequent swallowing. Stephanie is very, very good at making sure that his head, neck, and spine are in one line, and that he's got free airflow, but the chin is buried in the breast. Those are all important things to look for. But again, keep that laid-back breastfeeding in mind, because it causes babies to go up and over the breast and just have a better position, and especially with short nipples, that can be very, very helpful. The other thing is she said that she was more comfortable on the right than the left. And if you notice, she is much quicker on the right to pull him in more snug and lean back. She brings that bottom in a little bit tighter too, which can put the nipple at a better position in the baby's mouth, just so he can get a little bit deeper. Also, when talking about vasospasm, note that Stephanie did not report any soreness with pumping. And she said with her first baby, that soreness ended at 2 to 3 months. So it makes me question whether it actually is true vasospasm, or if indeed it was just due to the structures of his mouth getting a little bit bigger and helping to draw that nipple back just a little bit further, cause less pain. Next, we're going to go on and see the summary and feeding plan discussion.
All right, so a couple of things I want to talk about. When we did a post-feed weight, he was 12 pounds, 4.5 ounces, which is like 1.5 ounces up, which, for somebody his age, isn't a whole lot. So we'll see if he acts hungry again before we're done here. Feel free to feed him some more. And he might just not be eating as effectively because he's in a new environment. So that happens all the time. But at home, they do a better job of eating.
Yeah, it's about the normal time amount that he eats.
A couple things I noticed, like I asked you about right-handed, left-handed. When you were feeding him on the left side, I did see you lean into him a little bit more compared to on the right. You sat back more, brought him in, had his butt in closer, and you talk about that at home, sometimes doing the laid back where you recline back a little bit in feeding. As much as you can, I would encourage that, because you definitely look more relaxed, and he acted more confident and calmly there eating. When I looked at your nipples before you latched on, you're a really normal-looking shape now.
Yeah.
But like you said, right after birth, they weren't. And so you did all the right things to help those nipples become more normal-looking, from pumping to using a nipple shield. But from a normal-looking nipple, in my mind, there's no reason to really use that nipple shield unless you just can't get them latched and it's an old habit you're trying to wean from. But pre-feeding, those nipples look pretty darn normal now. Post-feeding, they still both look fairly round, but the face of them were blanched, were very white. And that would then correspond with your pain, too. So that when we look at his weight, he is getting enough to eat every day, and he's gaining weight well, he's peeing and pooping well. Today's feeding wasn't 3 ounces, like your bottle sometimes is for him. But again, I'm not certain if that's just because of a new environment or what. So how you're feeding him, the combination of breast and pumping and using bottles is working. He's gaining weight. Do you desire to be completely breastfeeding, or is this plan okay? You'd rather not have to do the pumping and bottle.
You gotta set them down right afterwards, and way more time consuming.
How many times a day are you doing bottles?
Depends. Usually, maybe like 5.
Okay. And then breast is about how many times?
Probably about the same. Probably more, like maybe 7, 8.
Okay.
Usually do it all night and then into the morning, and then either the afternoon or the evening I start on the bottle, depending on how I feel.
How your nipples feel.
Yeah.
And did you do that with your first? You did the combination bottles?
I do remember not breastfeeding for a while because of the pain.
Because what I'm hoping here is that as the closer he gets to 3 months, his head, bony structures grow bigger, he learns to latch on deeper, and you don't cause your mama so much pain. But as well as you looking at your technique, because clearly you look way calmer, way more comfortable on the right side than the left. If do you decide to wean from the bottles, or you're going to let pain be that guide?
Yeah, just whenever it stops being painful, stop using the bottles.
You go to Baby Cafe weekly?
Sometimes.
Weeks? Okay. Because like I said, how you're feeding him, he's gaining weight perfect. Your milk supply is good. And so now we're back to seeking a solution for his pain. And is it time on your body's part, time on his mouth part, and maybe a little training in terms of liking things at the back of his mouth, and then training for you laid back breastfeeding. And you know your body, because you've done this before, that when that nipple pain starts to go down, you can breastfeed more often.
Yeah.
Your milk supply is there. You've done a beautiful job keeping the supply there while the two of you are learning how to do this. Do you want me to write any of this down for you, or you got it kind of?
I think I kind of got it.
Okay. Any other questions you have for me?
No, I don't think so.
Okay. Well, I'm a phone call away.
Okay.
And I'll probably touch base with you about every couple of weeks just to see how things are doing. I hate to provide all this help and then I'm not here, but you're a wise mom.
Yeah.
You're doing a beautiful job.
All right, so now let's look at the summary. Let's put all the pieces together here. You saw throughout this assessment some time management techniques. While baby was at the breast, I was also asking questions and completing my assessment. And that's okay. Multitask. Women, you CPAs, you're good at this. You notice continued affirmations to mom, building her confidence and reassuring her that she's doing many things right. So now back to the nipple pain. Was it vasospasms or just a latch issue? Stephanie reports that the pain was just with feedings and not with pumping. True vasospasms hurt with pumping also. Thus, this really makes me think that this is more a latch issue and not vasospasms. In terms of weight gain and milk productions, again, you heard me tell her that everything is normal there. And these were not her presenting concerns. Her main concern was nipple pain with the feedings. Stephanie has done an amazing job keeping her production normal, even though she's been using a nipple shield and bottles. So during this feeding, which the feeding took about 15 to 17 minutes total, shorter on the left, about 5 minutes, and about 12 minutes or so on the right. Francis only took in 1.5 ounces. My sense is that that's just not what he normally takes in, due to the environment of videotaping and everything involved with this assessment. I frequently see babies not always taking in what they typically take in at home. So I'm not going to worry about that at this point, because overall he's gaining weight, his behaviors are normal, he's well hydrated, and his output is normal. We don't need to feel pressured to solve every problem we identify. This is a process. We're going to start with a couple of issues. We're going to let Stephanie know that we're going to stay in touch with her, and we're going to change things if needed. And you can use plans just like this with your moms. This is just the first step in helping Stephanie solve her breastfeeding situation. You also observed me review mother's goals in a very calm, laid-back approach. This is client-centered care, and it was important when we're putting feeding plans together for Stephanie or for anyone that we figure out what are their goals, what are their intentions, what do they want to change. And then the last one is the feeding plan. You heard me verbally go over it with her. And I asked her, would she like me to write it down? She declined, wanting a written plan. Yet if she did, this is what a written feeding plan would address and would look like. So again, going back to that three-step process, we need to come up with a plan to feed Frances, feed her baby, protect her milk supply, while we're seeking a solution. Keeping plans simple is helpful for everybody. So for number one, for feeding Frances, she's going to continue with breast and bottles. While she's going to continue working on positioning and latching. She's going to work on weaning from the nipple shield, and she's going to wean from the bottles as her pain decreases. Very simple. In terms of protecting her milk supply, she's going to continue to do what she's been doing. She's going to continue to feed as she's been feeding, and she's going to continue to pump as she's been pumping. Nothing's broken here with her milk supply, so we don't need to fix that. Just keep doing what she's doing. And then seeking a solution. So time, you heard me say, in time, Frances's oral structures will grow just like they did with her first baby when the pain went away around 12 weeks. So I'm giving her a name. Time is some of the issues here, and how much time. So 6 more weeks. Hopefully all of this pain will go away by 12 weeks of age. She's going to try some different positioning and latching. Try weaning from that nipple shield. I didn't chat with her during this assessment about continuing with a peer counselor, but she will continue with the peer counselor and continue to go into support groups as needed. I often find that when mothers are given a name for their situation and the time frame, they can survive, push through it, while you and the peer counselor are being her coach and walking with her over the next 4 to 6 weeks. Moms need words of affirmation, words of praise and support, so be there for her. This type of help will increase all moms' confidence and in turn increase their duration of breastfeeding. So now the rest of the story on Frances and Stephanie. I did call Stephanie every 2 weeks, and by around 10 weeks of age, she was exclusively breastfeeding without a nipple shield and without pain. She agreed that Frances needed time, she needed practicing on getting a deeper latch, and he needed to learn to open his mouth wider. So they are currently successfully breastfeeding without the pain. You can do this. We encourage you to watch this webcast multiple times. Practice just with one mom and one baby at a time. And over time, you, as a CPA in WIC, will become more confident and will be quicker at doing targeted breastfeeding assessments. We are now going to take a short break for you to send in your questions, and then we will return to answer those questions that are submitted. So since there are no questions at this time, we would like to thank you, the viewers, for listening. And remember, you can watch the archived version of this webcast again and again and use it for future CPA trainings. Using the feeding plan as a quick guide to problem-solve breastfeeding challenges is a great way to start learning how to do these assessments. And continue to collaborate with your designated breastfeeding experts at your local agencies. If you have any questions, feel free to contact one of your regional lactation consultants for any concerns that you may have now or in the future. Because remember, together we can support our breastfeeding families in Michigan. Thank you and have a great day.